The budget this year is a whopping 64.8 billion rand. 30 years ago, it was a mere 3 billion rand. That's right, only 3 billion rand, and in the year 2000, it was still less than 6 billion rand. Granted, the population has more than doubled since 1994, but even adjusting for inflation, the health budget is significantly higher on a per capita basis. Now, the big question, the really big question, is whether this huge budget is spent properly. There are many good things being done by dedicated workers who really want to do the best for the health of our people, but they are let down by top management. The Auditor General reports have painted a picture for many years of terrible financial management and massive misspending. The scandals never seem to stop. We saw the arrogance and the moral corruption that led to the life of Sedimeni abuse of hundreds of mental patients. Then there were the vultures who pounced on the 2 billion rand made available for the COVID medical emergency. This included the PPE scandal, the empty wards built at Kopanong and other hospitals, and the 500 million rand spent on the abandoned Anglo-Ashanti hospital. And then Babita Deokaran was assassinated when she tried to stop the grossly overpriced contracts from fake companies at the Tembisa hospital. Now, before her death, Babita asked for an investigation of suspicious contracts totaling 800 million rand. But it was all covered up until dedicated journalists forced it into the open, and we heard about the skinny jeans and the 5,000 rand armchairs being bought while casualty patients slept on the floor. And I have to ask you, there are the usual disciplinary delays for all of this. The chief financial officer has been suspended on full pay now for 2 years. How can this be justified? You know, as usual, I was viciously attacked by the department when I referred the fishy appointment of the Tembisa Hospital CEO to the Public Protector. But guess what? The Public Protector found severe irregularities in his appointment. And it turns out that the department has not been doing proper pre-employment checks, and they've now been ordered to appoint a service provider within 4 months. What we really need to ask is how many other senior appointments have been done without the necessary checks. The Health Ombudsman did a scathing report on the appointment of the completely unsuitable CEO of Rahima Musa Hospital that led to so much trouble there. And now there is a dispute about the qualifications and experience of the new CEO of the Chris Hani Baragwanath Hospital. You know, you would think that a department that is so mired in scandal would ensure there was no hint of impropriety with its new head of department. I think it is very suspicious that Mr. Arnold Malatana was appointed at HOD by the Honourable Premier 2 months ago after acting in this position since April last year, but no public announcement was made. Why would this key appointment be kept secret for so long? I'm most concerned that Mr. Malatana is reportedly being investigated by the Hawks and the SIU for a tender rigging scheme at the Masakani Cook Freeze factory along with 2 other officials. They allegedly shared a bribe of 8 million rand. Now, the Public Protector also criticised Malatana for ignoring, quote, material discrepancies in the irregular appointment of the Tembisa Hospital CEO. I really have to ask this House and everybody here, are these not red flags when you are appointing the top position in a department plagued by corruption and incompetence? I'm actually going to be very blunt about what I think is happening here. The crooks are still in charge of this department. They want to keep their multiple scams going and to protect the looters. If there was another Babita Deokaran in the department, she would be silenced. This is the prime reason why the DA is not supporting this health budget, and neither should anybody else in this House until fundamental changes are made in this department. I call on anybody who says they've already pledged support for it, reconsider it now. Lives are being lost because of incapable and dishonest officials. Former health official Kwadani Mashlangu has been found criminally negligent in the inquest into the deaths of Sedimeni patients. You know, I wonder if something similar can be said of the unspent money that was set aside last year for the urgent treatment of cancer patients. And this is a subject of a court case brought by the Cancer Alliance, Section 27, and the Treatment Action Campaign. These are all very worthy organisations that the department should be working together with, but they are forced to go the legal route to get effective action to save the lives of cancer patients. You know, at one stage, there were 3,000 cancer patients waiting for treatment. The number of those who could die or have already died because of delays could well be more than the 144 who died from life-sedimeni. And just think of the suffering of cancer patients and their families as they wait for treatment. If any of you have had a family member who died of cancer, you know exactly what it's like. It's just absolutely appalling that this is happening.
You act very guilty.
You know, I could go on about the manifold failings in this department, including poor emergency response times, high neonatal deaths, low childhood immunisation, and there's a statement in the budget book, which I'm just quoting from it, none of the capital projects were completed. You know, you say it in the budget book, none of the capital projects were completed. I mean, that's quite damning. But, you know, there's an interesting thing here. The Honourable Premier talked about these 18 private hospitals which some pension fund was going to buy for us. Well, there's no budgetary provision for these 18 private hospitals, which I presume it's no use having a private hospital if you haven't staffed it and equipped it. So I don't see any budget provision for these 18 private hospitals. So, to conclude, this is a department that needs to be rescued to save lives and provide the best possible public health service within the available budget. The reason we have this situation is because of the minority coalition in Gauteng that has consciously chosen not to emulate the national unity model of government. I'm calling to everybody here, this budget vote should be rejected until there is evidence that top management is untainted by corruption and past failures, starting with an urgent review of Mr. Malatana's appointment. Thank you.
Well done.